I'll hit the OK button. All right, wonderful. Thank you so much, Leah. I am Hillary Jericho, a pediatric gastroenterologist and the medical director of the Stanford Children's Health Center for IBD and celiac, but specifically the medical director for the celiac program. It is such an absolute honor to welcome Elaine Taylor and Molly Stone today. Elaine Taylor is the co-founder and president of the Taylor Family Foundation, the founder and co-builder of Camp Arroyo, and the host and funder of Camp Celiac. Molly Stone is our director of Camp Celiac. I think we will start off this hour with Elaine, who's going to give us a brief overview of Camp Celiac, including, what inspired her to start the program. As Leah said, after the initial educational piece, if there are any campers or counselors who want to add into the conversation, we'd love to hear from you. And then after Elaine has shared her experiences with us, we are very fortunate to have Molly Stone here, the director of the camp, and share her thoughts and experiences as well. So at this point, I will turn it over to Elaine.
Hi, thank you for having me. Thank you for the kind words. I started camp 36 years ago with East Bay Regional Parks. They were looking to do a school camp, a science ed school camp, and I was looking to do actually a camp for children with HIV only. And by the time we opened the camp, it was a 144 bed facility, and initially there were 1,000 children in the Bay Area that were infected or affected. And by the time we opened, there were less than 300, and about 2 years in, there were less than 150. So we opened up camp, and at that same time that I was building camp, I found out I had celiac disease. And so while I was mourning my bagels and bread, I also was, starting to look around at what is the population? Where are I met a lot of adults, but where are the pediatric kids? And I lucked out and met a mom who was a real advocate for children with celiac disease. She invited me to come to Stanford. Stanford used to have a great conference with all these tasting booths, and it was just an incredible thing. And you bought a ticket. Well, I didn't know you had to buy a ticket, so I just show up and sneak in the back door and find out that, oh my God, I'm going to get thrown out by the security guard. And the mom got me in, and I got my 10 minutes of being able to get up and speak to everybody there. And it was a packed house. And what I needed were some parents who were willing to do the back end paperwork, and we would put on camp. And the things that were needed from them was a doctor, a nurse who could support the doctor if the doctor had something else going on. And we also needed counselors, and then some volunteers, for whether it be archery or helping us produce and put on camp. This is in the very, very early days. And so when that happened, I lucked out again. I got to speak, and I got real interest. And then we worked hard to get Jackie and Doug Corley to be the parents who took on that back end of the house for us. And from there, we got Richard Bernstein to be the camp director. And being that I was a celiac, I understood the kitchen really well. And I decided to kind of dedicate myself to that and really understand how to keep that kitchen clean, how to go solicit and get donations for, at the time there was no Udi's bread, and Udi's came on the market, and we literally, Camp Celiac put them on the market. They came and they brought a pallet of bread, and it was like they were the belle of the ball for what everybody had been eating. And so it allowed parents to meet new vendors, see new food. We used to do really big goodie bags with recipes and what vendors and all the vendor gifts. And it just put this celiac camp on the map. And the reason it put it on the map was because it was free. You guys pay a $25 registration fee, and everything else is free. And the food, our mission was to bring these kids food that they could never get anywhere else. And I think Molly can attest, because she was a camper, that's what we did, and it's probably one of my favorite camps because it's the happiest camp. As long as we make sure everybody is safe with their food and we are giving them just phenomenal food, these kids are happy, and it's very food centric. So it is one of our highest producing efforts in our kitchen. So that's really what I do is I fundraise to make sure that all these camps, there's 32 programs, different programs, and I make sure it gives these kids this chance to be just like me in their environment. So that's me.
Thank you, Elaine. Okay, so my name is Molly, as Dr. Jericho said. I was diagnosed with celiac disease in 1992 at the ripe old age of 20 months old. And I started out as a camper / counselor the very first summer of celiac camp when I was 17 years old. And then I attended every summer since then. I kind of worked my way up through the leadership. I was junior counselor, I was a counselor, I was the camp EMT, the camp nurse, kitchen liaison, and then Richard kindly took me under his wings many moons ago, and I took over as the director starting in 2019. So just some brief information about Celiac Camp. So it is held at Camp Arroyo, which is located in Livermore, California, and it runs this year. It'll be July 9th through the 14th. Campers are aged 9 through 15, and junior counselors are 16, 17, and 18. And then counselors are over the age of 18. Camp registration will open on February 1st, 2025, around noon California time, and the link to register is going to be on our website, celiaccamp.com, or if you just Google Celiac Camp Livermore, Celiac Community Foundation of Northern California, or anything like that, it'll pop up. It is different from Camp Celiac Strong, which is located in New York, which also registration opens for on February 1st. We sometimes get some crossover and confusion. Celiac Camp has 144 beds for campers and staff, and it's mostly staffed by young adults who are also celiac or gluten-free. Everyone who's on camp campus during our 6 days needs to adhere to a gluten-free diet. Our activities range from a ropes course, a full day of Olympics, pool, archery, capture the flag, talent show, skit night, a theme dance, and much, much more fun. As Elaine mentioned, camp only required cost is a $25 non-refundable registration fee, but camp does cost a decent amount of money, and the difference is covered by donations and grants. So just some brief reasons why it's important for you to kind of choose a celiac camp for your campers. The food, that's the main reason most of us come. The food's 100% gluten-free. The food is amazing, and we have desserts after lunch and dinner, and then we have s'mores. And there's tons of snacks, but more than that, having a community of people who are just like you, as Elaine said, and truly get what being celiac and gluten-free means, more so than just, oh, we have to be gluten-free, but really understanding not just the diet, but more the psychosocial issues that come with celiac disease and growing up with celiac disease and growing up different than your peers. Year-long relationships with fellow campers and staff members. I had about 40 people from camp at my wedding, and I've gone to a lot of camp weddings, and we're all in touch with everyone throughout the year. Your campers will get the contact information of the parents of everyone else in their cabin, and then a lot of the staff will share their phone numbers for you guys so that they can get in touch with you throughout the year. And then we have a very active social media page where you can see pictures and interactions and food that we had from camp throughout the year. Leadership experience, it's great for junior counselors and counselors to kind of get a great leadership experience for the 6 days of camp. And then getting to experience like what a normal summer camp is without having the additional anxiety that comes with food, especially like a sleepaway camp. I know when I was growing up, I was never able to go to a sleepaway camp like my sisters were, and it was really life-changing for me at the age of 17 to finally kind of experience what a real, sleepaway summer camp is. I felt like it was like the real Parent Trap experience. And then exposure to local and new gluten-free products and companies. We work tirelessly to get donations and the best tasting products and food that we can. We're very picky with the products that we get. We do not allow energy bread to be donated to us, even though they want to. We really make sure that we get the best of the best food. And then guidance from young adults who have been through diagnosis, high school, college, and even adult life with celiac disease. It's really nice for your campers and junior counselors and counselors to have people to talk to when they're kind of experiencing new stages of life and needing advice and guidance on kind of how to move through growing up. Just some facts about the medical staff that we have on campus. So camp always has a medical doctor, a nurse practitioner, and then usually we have a paramedic, a nurse, or medical student, and they all sleep on site. So they're going to be there if your camper has issues. And then I'm also, fun fact, also a registered nurse and halfway through a master's program. So I'm also available to provide medical care in case of emergency. We have what's called the med shed, where campers will go every day to get their routine medications, or if they're not feeling good, if they're tired, if they're dehydrated, if they just kind of need a break. The med shed's air conditioned. It has lots of snacks, Otter Pops, Gatorades, and medical staff are there to help kind of triage and see what's going on and help kids with stomach aches, sprained ankles, kind of whatever's going on, or if they just need to take a Tylenol and rest, or just need some downtime and some quiet space away from everything else that's going on at camp. We do require campers and staff to be tested for COVID-19 when they arrive at camp. And then it's up to our medical staff if a camper's either test positive or is showing signs of COVID or the flu or any other communicable diseases. We do require that parents not to leave the area or the state, so that in case if their camper is sick, that they have to be picked up the same day. And we do encourage all campers and staff to be vaccinated against COVID. We have a ton of experience with campers with diabetes who need growth hormone injections if they have Crohn's and colitis, other autoimmune disorders, or other food allergies or intolerances. Unfortunately, just with our kitchen, we're only able to take care of kids who have nut allergies or need to be dairy free. We can't accommodate a ton of other allergens just because it's too much work on our kitchen staff. Junior counselors are ages 16, 17, and 18. We do require our JCs to take a gap year, which is essentially 1 year off between when they were last a camper and their first summer as a junior counselor. Most junior counselors take this when they're 16. Some of them take it when they're 17, and a few take it when they're 15. But we do prioritize junior counselors who apply, who are going into either their freshman year of college or their senior year of high school before we accept ones going into their junior year of high school, just to make sure that we get the counselors a chance to be a JC before they are over the age of 18. And then counselors or any adults over the age of 18. Many of our staff started out as campers or junior counselors, but we really love fostering a great community for adults as well. So even if you've never been to camp before and you want to volunteer, I encourage you guys to apply. We might not be able to get you a spot, but we do have a waiting list, and I fill slots on our waiting list up to the day of camp. So it's important to just kind of keep applying and keep that week open. And then we really try to not have parents of campers attend camp, because we want our campers to have a true summer camp experience and get away from mom and dad and not feel like their parents are there kind of watching. And so we really try to not have moms and dads of current campers come to camp. And then just a couple things, like if you choose to not come to a celiac camp, but you still want your camper to go to a summer camp, I just came up with some questions that you could ask kind of those summer camps. So is it for the kitchen? Is there a separate place where they prepare your food? Do they kind of understand cross-contamination? Do they allow you to bring food in for your camper? And do they allow for any other dietary restrictions? And then for the medical staff, are there medical staff on site? Do the staff kind of understand the difference between celiac, which is a gluten intolerance, versus food allergies and like the difference between like symptoms and versus, anaphylaxis and things like that. And then is there somewhere maybe in their medical area where your camper could store snacks or foods in case the meals provided are not safe for them to eat? And then just some miscellaneous, like, is your camper allowed to communicate with you during camp, especially if they get sick? At our camp, we don't allow campers to have any cell phones. Any sort of communication, you'll only get a call from me if there's an emergency. And we really discourage parents to contact us in case of, unless there's an emergency, just to kind of allow for camp to run as smoothly as possible and to allow both campers and staff to be fully immersed in our camp experience. And then how many campers who attend are gluten-free, especially if it's like a camp for kids with other chronic illnesses? Like, do they cater towards kids who also have celiac disease? Is it like a diabetes camp that also kind of has a high population of kids who are on a gluten-free diet? And then if they're like a Girl Scouts or a Boy Scouts camp, do the policies vary from camp to camp? So like you could have, say, a Girl Scouts camp in Livermore that's really good about celiac, but you could have a Girl Scouts camp in Orlando that has no idea what they're talking about. And so you want to make sure that you're able to talk with the facility that your camper's actually going to be attending versus just the larger organization. That's all I got.
That was absolutely amazing, Molly. I had a list of like 20 questions I was going to ask beforehand, and I think I've whittled that down to just 4 now because that was so amazingly thorough and incredible. Before we turn over to the audience, I might just ask a couple more that I didn't hear you address, but might be worthwhile hearing you talk about, and then I'll open up to the audience to ask any questions that they have. And I apologize if I missed this, but I didn't think I heard you speak about if a family registers and doesn't get in, is there a wait list? And then if there's a wait list, how does that get incorporated into the subsequent year's registration? Is there any priority for those patients that are on the wait list?
Yeah, so we have a whole like 9-part registration priority on our website, which goes into super detail about how it's done. But essentially, if you're placed on the wait list and you don't get a spot, say you were on the wait list in 2024, then you will get like #1 priority for camp in 2025. And then something we encourage for you guys who are on the waiting list, unfortunately, we have a ton of campers that register and we just only have 144 beds. Most years we have over 300 people register within those 14 days of priority registration between February 1st and February 14th. Is keep that week open for the summer. Try to not plan for your camper for you guys to take a vacation or do something else, because usually the month of camp we get upwards of like 20 or 30 cancellations, or someone comes down with COVID or the flu, or they were exposed to someone with COVID, or they're not feeling good. So we probably, even last summer, we filled probably 5 spots the day that camp started that morning from the wait list. And I will call a parent and I will just move my way down the wait list and say, hey, we have a bed open. Can you get here by, bedtime, which is 10 p.m. tonight? And if they can, then that goes to them. And if they can't, then we just keep moving down. So it's really, I suggest it if your camper really wants to come to camp to kind of keep that week open, because there's a good chance that week before camp starts, you'll probably be getting an email or a call from us.
That is super helpful. Thank you. Another question I had is, it sounds like you guys do amazing planning and games and activities. Are there opportunities for the campers to have education about celiac disease? Do you guys do any formal education sessions, or it's more just a typical summer camp, games, craziness, all of that sort of stuff?
So it's a combo. We don't have any here. I'm going to share this registration priority so you guys can take a look at it. That's on our website.
Oh, great.
So it's kind of a combo. Some of our counselors who work in the medical field, we have different like free time activities. And so some of the counselors choose to do like an hour-long kind of like informal teaching or whatever they kind of want to talk about. And campers during free time can attend those little free time activities. And those activities aren't necessarily educational. but some of our counselors who either work in the medical field or work in research or things like that kind of choose their little free time activity to be about, the science of celiac or kind of whatever they want. But there's no like formal sit down like education, but we found that it really comes up in conversation pretty freely and openly. And the longer that campers are there, the more questions they ask. And we also, our doctors, like, and our nurse practitioner, Jenny, she's a celiac. Dr. Amy, one of our doctors, is a celiac. Dr. Doug, his kids have celiac. So like a lot of our medical staff have firsthand experience with it, along with either being GI docs or family docs who treat a lot of kids with celiac disease.
Wonderful. Okay, one last question, and then I'm going to turn over to the audience. And the only thing I was going to say, Molly, is I think your cursor's over that top thing. So there we go, just so people can see the website. So my last question, and then I'm going to turn over to our participants, is what sort of steps do you guys take to support children socially and emotionally? Obviously, when kids are going away to a camp for the first time, the sleepaway camp, it can be very stressful. Can you talk a little bit more about that?
Yeah, so I think it varies from case to case basis. We do like a day-long staff orientation the day before. So if you're in the audience and you're thinking of becoming a staff member, either junior counselor or counselor, you're actually going to be required to be there on July 8th, just if you're putting that in your calendar. But we do like a counselor orientation where we go over a lot of like situational based things that are going to come up at camp and how we handle it. A lot of our staff have been counselors since the very beginning of like 2007, 2008. A lot of them also started out as campers. And a lot of them have a lot of experience dealing with campers with various issues, anxiety, sleep disorders, kind of going away for the first time, homesickness, and things like that. And we really work on kind of teaching our staff about how to handle those situations. And then if they're not comfortable handling a situation, who to go to who has experience handling that. Because if you are a first-time counselor or first-time junior counselor, you're obviously not gonna kind of know how to handle it the first time. But we really try to foster a sharing environment, and where it's not really like, these are my campers and I'm only responsible for these 8 campers this whole week, but it's like, I'm part of a whole of this staff and we want to make sure that all 150 people on campus are having a great time. So if I'm not sure how to handle this, then I'm going to go to X, Y, and Z people to see if they can help me handle this situation. And our doctors and nurses and everyone, the med shed's a great place for our campers to go if they are feeling anxious or homesick or have an upset stomach because they're anxious or homesick.
Or ate too many yummy gluten-free treats.
A whole plate of cinnamon
The
rolls.
food is amazing there.
But it's just a great place for them to kind of step away from camp and have a little bit of a safe space where if they're kind of having issues, and then if so, we will call parents. We do our best to not. But if they just want to talk to mom and dad for 5 minutes before they go to bed, and that's what we kind of deem fit as necessary, it's really like a last resort, because a lot of the times it ends up making the camper a little more worked up. But we will call home. So especially if you have a camper who's maybe never been away from home or never been to a summer camp or has some sort of baseline anxiety issues, don't be surprised if you get a call from me or a text from me at 9 p.m. saying, your kid just wants to say goodnight. And usually I phrase it so the kid feels better is, like, I don't like to say like, oh, they're missing you, but I like to say they just wanted to check in and see how you're doing. Richard taught me that. But they just wanted to check in and see how you're doing and make sure that you're having fun without them, something like that, so that they don't see it as a negative of like they're, shouldn't be anxious or shouldn't be scared that they're away from home. But I think if we all went to summer camp, we remember that first time away from home and being stressed or being scared. But our counselors also are really good about like doing a nighttime meditation or like yoga or, playing calming music with, a lot of them bring like projectors So yeah, I rambled.
Wonderful. Thank you so much. That was so much incredible information. We're so lucky again to have you and Elaine here today. So at this point, we're actually going to stop the recording. And we really encourage anybody